With a practice focused and a teaching institute focused on total body wellness. So it is so critical that we raise these children with all the advantages that they need in order to be able to move forward in life in a healthy manner. What we do for our babies, at least by the age of 2, with guiding and developing their dental arch form and their bite issues, that will impact them positively for their entire lifetime. They will not only live more energetic lives, they'll be more focused as children in their work and in their learning, children and adults, in protecting them from issues of ADHD and sleep disorders and sleep apnea and so forth. And I think we need to also understand that a child who snores or breathes through their mouth is never normal any more than it is for an adult to do that. And there's nothing more cruel than to allow a child to be raised up watching this and knowing that there is a way to make a difference. And what's so beautiful about Orthotain is that this process is so simple and makes an incredible lifelong impact on this child from the age of 2 and forward. It's just I think it's a message that absolutely needs to be heard loud and clearly by not only our pediatric dentists, our orthodontists, and general dentists. And for many of us, it's our general dental practices where these children are screened and sometimes maybe forwarded on to a pediatric dentist if the general dentist is comfortable moving in this direction. But I'm here to say that it is a very smooth process, the training and jumping through the hoops to be able to feel very confident and accomplished as a doctor and team to provide this care for children. Most importantly of all, and how I think this certainly relates so significantly to practice that's focused on total body wellness through dentistry. And I am going to make a niche, making a niche within our practice that supports children on this journey. And if you're near a hospital or a place where, a children's hospital where there are so many children who could benefit, who absolutely desperately need this kind of care, it's just an absolute perfect place for us to step in and help support what the doctors are doing, what the parents are doing to help their children. So I'm just so excited to be a part of this movement and so excited to be partnering up with children's hospitals and other facilities that care for children, especially those who have medical needs that are diagnosed. But what we really have to look at on a daily basis within our practices and screen and question our parents, and because breastfeeding for longer periods of time is going to increase that rounding of the and width of the dental arch, which is so critical to the improvement in breathing and prevention of sleep disordered breathing and just disordered breathing in general. We've all seen the children that walk around with their mouth open, breathing through their mouth because they cannot breathe properly through their nose. Their tonsils and adenoids are swollen. This is all an inflammatory process that contributes to gum tissue inflammation and inflammation everywhere else in the body. We do know that oral inflammation, including airway inflammation and periodontal inflammation, is the most significant area of inflammation in the human body, and inflammation is the root cause of almost every degenerative disease known to man. And as parents and grandparents, we're in the perfect position, and we may be the only ones who ever have an opportunity to identify these issues and bring them to the forefront and search on the internet and search out the doctors in your locale that are a part of this movement. There aren't a whole lot in some regions, and we're going to change that, at least in my part of Virginia.